Hi, I'm Samantha. Welcome to the Evidence-Based Mommy. And today I have a special guest with me. I have Dr. Marcy Rowland. So she has her PhD in clinical psychology. And tell me, who all do you help? What kinds of...
Well, I specialize in working with young adults and individuals who are facing life transitions.
Okay, so life transitions could be a lot of things. I'm sure one of those life transitions might be becoming a new parent.
Absolutely,
right?
absolutely. There's nothing more life-changing than adding somebody to your family.
That's very true. So say that you've got a new mom coming in here. What do they come in to talk to you about, or what are they feeling that they actually come to reach out to you?
That's a great question. I think that new parents might present with a lot of concerns regarding this transition that they're facing. Some of those concerns are, of course, about the well-being of their child, so focused on making sure that their child has everything that they need to grow and become the young adult that one would hope them to be. And sometimes there are changes in one's relationships that result as a result of becoming a parent. What might have been a family of two has now become a family of three or more, and that can strain the pre-existing relationships within a family system, whether that's between one parent and another, or a parent and a child that has already been a member of that family. And I think we also see many presenting concerns regarding oneself, anxieties that may crop up that weren't pre-existing, things one didn't worry about before becoming a parent that now become of greater concern.
Well, because first of all, you've got a whole new responsibility, and then on top of that, you have those hormones kind of going up and down, and all sorts of things.
Maybe some sleep deprivation.
Yes, absolutely.
That can have a significant impact on one's mood as well.
I remember when I had my second child, I had a really hard time. Before she was born, I was terrified of, how could I possibly love another child the way that I love my first one? And then after that, I had a really hard time coping with my toddler at the time.
I bet. Yeah. And so I think a lot of new parents, whether they're first-time parents or parents of a second or more child, struggle with those feelings of guilt. I think that might be what you're describing. And as you also mentioned too, feelings of comparison.
Yes.
Wanting to think back to how it felt when you brought your first child home and how you transition to being a parent to that individual, and then maybe adding another child to your family as well. And I think, comparison is just such a slippery slope.
Oh my gosh, yes.
Because we really don't remember quite accurately how we felt or how we coped with a period of time in our life that may have been a year or more in the past. And really, that comparison does nothing more than sort of rob us of the joy in experiencing this new transition. It will always be different than the one that was before, but different doesn't mean better or worse.
That's true. And even, with the first child, the classic, I'm still going to keep the house up. I can get my book that I always wanted to write done, or whatever it is. I've got this time with maternity leave. I'm going to get all this stuff done. The house is going to be perfect. And that's just not the way it is. And a lot of times you can be really disappointed with yourself, or really even, angry at yourself because you're not doing what you think you should.
Yeah. And I think that, social norms don't help us out in this regard either. I think we are led to believe that having a child should be maybe the happiest time in one's life. And social media may also compound those expectations. And what we know is that transition can be incredibly painful and incredibly hard.
Yeah.
And I think a lot of new parents struggle to say that out loud.
Yeah.
Which sort of retreats us back into ourselves and promotes this sense of silence that can really just reproduce shame.
Right.
So one of the things that I would, encourage all parents to do is to really be honest and to reach out to our support networks about those feelings. Ugly, painful, difficult, happy, the whole range of those feelings. But once we shine a light on the feelings that we have, the likelihood of experiencing shame around those feelings really goes down. And it allows us to connect with one another in a vulnerable way, which really deepens our relationships. So that might be something for couples as well, that it might be most difficult to share your painful feelings with your partner. Again, expecting that they have expectations for you about how you might be feeling during this time.
Right. But you feel like you're supposed to be happy when a child is born. And I've talked to a couple of people who said that it took some time, days, maybe even weeks or longer, before they really felt like they connected to their new baby. And that is a terrifying experience.
Absolutely.
Am I always going to feel this way about this kid? Like, what have I done? And who can you tell that to?
Right.
That's what people are scared of.
Exactly. Yeah. Will I be judged for having those thoughts or feelings?
Right.
And once again, like I said, I think that's what, leads us to be so private about our feelings, to refrain from sharing them even with our closest friends and family members.
Mm-hmm. And whenever I've struggled with anxiety and whatnot, I know, like, I'll get really locked into a mindset, and I'll feel like I can't tell someone. And it's funny because even, like, if I get past it, even the next day, I'll be like, that was completely irrational. But what do you do for yourself when you think you're probably locked into some sort of mindset that's not helpful, but you don't really know how to get out of it?
Yeah. So if you were to be dealing with these thoughts on your own, I think it could be really useful to identify whether what you're thinking is based on facts or feelings. Oftentimes we are distorting the facts, distorting reality, and the way in which we do that can contribute to the anxiety. For example, getting ahead of yourself in terms of maybe predicting the future about what might be happening for your child or for your family.
Right.
If today is a particularly hard day and you are unable to put your baby down because they are inconsolable, I think it might be easy for one to jump to the conclusion that the next day is going to be more of the same. So predicting the future based on something that is happening today. So again, that is not a reality-based thought. Right. It is, of course, a reaction to the distress that you're experiencing today, but it is no more likely to happen tomorrow than the contrary, which might be that it could be a very peaceful and contented day. So again, wanted to check in with your thoughts to see whether they are rational or irrational.
Right.
And if they are irrational, making sure that you're not using those irrational thoughts to determine how you should feel. Sometimes we're not capable of determining what's rational or irrational on our own.
That's true, especially when you're really caught up in it.
Yeah, and so that's when it would be particularly useful to share those thoughts with, a supportive loved one, somebody that has a level head about them and that can give you a bit of a reality check. And if that's not somebody within your social circle, then that is somebody that might be a professional in your life.
Right.
Somebody like a psychologist or a therapist.
How do you know when to reach out to someone? Because again, talking about being locked into your own head, there's a lot of stigma about, like, you have to be really crazy to go to a therapist. Like, how screwed up must I be?
Yeah.
That kind of thing, which is not true.
No, and it's an unfortunate myth.
But that's what a lot of people will think.
Yes. So, and I want your audience to know that I think that the healthiest individuals are those that are willing to engage in treatment for themselves. Those are the people doing the hard work and the self-reflection to develop the coping skills that people who might not seek professional services may not know. Back to your question about how do you know when it might be time to seek professional services. Typically anything of 2 week or longer duration.
Oh wow, that's a lot shorter than I would have
imagined it to be.
Right.
Yeah.
That's good to know.
Yep. So for a mood-based episode, a 2 week period of time in which these symptoms are present nearly every day, all day, that raises to the threshold of a time in which you might want to seek a medical or counseling professional.
That's really helpful. And, since we've been talking largely, not only, but largely about postpartum stuff, it feels like we're told, that postpartum depression or postpartum anxiety is going to show up just within that first month or 6 weeks or whatever, and after that you're in the clear. But that has not been my experience.
Yeah, nope. So, I think really we can be talking months out.
I think I've always had, now that, looking back 3 kids in, it's around month 4 or month 5 that, like, if I'm going to go kind of haywire, that's when it happens. It's
Yeah, and I really applaud you being able to sort of track those symptoms for yourself.
Took a little while to figure it out. Yeah.
Sure, yeah. But being willing to track your moods, I think, can also be really important data
That's a good point.
both for yourself to see what is kind of your norm or what deviates from the baseline, but it could also be important data to present to your medical professionals or your treatment team if you are noticing that there is a significant decline in your mood or your ability to function, to be able to present that information to somebody who is working with you, whether that be with medication or just in terms of talk therapy, could be really useful.
Right. And we can talk another day more in detail about this, but just so you know, you can take, there are several antidepressants that you can take while you're breastfeeding, and they're safe. The very low levels get passed through breast milk, but we'll talk about that later. So that's a big subject.
But yes, important subject nonetheless.
It is, yeah, because that's something, that a lot of people, I think, struggle with, worrying about, like, well, I can't take this medication because I'm nursing, or, I have to stop nursing because I have to take this medication, or whatever. Neither of those things are the case.
That's right. Always important to check in with your medical professional, but there certainly are medications that are safe for both you and the baby.
So thank you so much for coming today. It's been great to see you, and I hope to have you back sometime.
I would look forward to that. Thanks so much, Samantha.
Oh, you're welcome.